know that baby boomers are going to be retiring at an alarming rate over the next 10 to 15 years. So why is it that folks in the healthcare industry are not sitting here saying, wait a minute, we know we're going to need people. So why are we not aligning ourselves now with community colleges to be able to say, here are X number of jobs we are going to need every year for the next 10 to 15 years, and we have to fill them and not wait for folks to come around to possibly come after these jobs. In Chicago, ComEd, they determined that they were losing baby boomers, the folks who actually climbing the utility poles, driving lines, checking power lines. So what did they do? They went to the City College of Chicago. They created a 9-month program designed by ComEd where they said we are going to train folks and certify them in this area. When they came out of the 9-month program, they were walking into $70,000 a year jobs. Not college graduates, not 4-year graduates, not even 2-year graduates. 9-month program. Because what did they realize? They realized that the people who were auto workers 30 years ago don't have the same middle-class type jobs that don't require a college degree. And they said, we need the workers. So they went to the 2-year college and said, we need to create this kind of program because we have to fill these jobs. They created the program, established the curriculum, and they said, so we know when they come out, they've been trained according to our standards. A perfect partnership between private industry and a public university in the city college. Why is it that we know right now, if you look at the private sector jobs for the past 8 months that have been created, anywhere from 20, 30, 40,000 a month, I mean, obviously not the numbers that we need. What is the leading category of private sector job growth in the past 8 months? Healthcare. It's the leading area. Economists are telling us right now that the job creation over the next 10 years, healthcare will be the leading category. So here we are running around screaming, oh my God, the world is going to end because of the healthcare reform. And even before the healthcare reform bill, healthcare was the leading job creator in the private sector in the country. And so the question then becomes, how do we recognize that it's here, it's been passed, we have to continue with it, it's going to be harder for them to overturn healthcare than it was to pass it. And so why are we not positioning ourselves for the future to say, how do we now deal with what is coming down the pipe? Here's another area. How many of you have actually gone to some of those 24-hour healthcare facilities and strip malls that also stand alone? Probate or those things. I have. And here's what's going on. All the healthcare debate people said, you know what? All of these different, people not going to, offices will be clogged. They got to find the private doctors. We don't know what's going to happen if this goes down. And I'm sitting here saying, hey, first of all, don't assume people are always going to find that family doctor we used to have. People still have the mentality, I go to a doctor, I need to go to a doctor. All right? Which is also kind of crazy. You should have regular checkups. But I understand the mentality. So, if you are an entrepreneur, and you're sitting here saying, where's the future growth? The future growth will likely be in the franchising of those very institutions. Because, again, if you're sitting here saying, we don't want folks coming to emergency rooms with basic ailments, and those kind of facilities are going to serve those kind of ailments, and folks are going to have health care as a result of this plan, then you are providing a service to meet the need of the very folks in the various communities. Same thing, look what's happening in New Orleans. I sat down with Mayor Landry. They said they're after the truth, and they opened up any number of neighborhood clinics all across New Orleans because they determined they could not have a healthcare system in New Orleans that was solely based upon having the one major hospital and everyone coming from all over New Orleans to this one hospital, clogging it up, and then providing the kind of services they said that they could provide in the individual communities. So it's amazing how what happened is in our country, and I cover city law, I cover county government. city budgets began to crunch, and so they said we will shut down community clinics to save money. Why did they say that? They said because they go to the county hospital. When we talk about the healthcare debate, I told folks all the time, oh, we have a healthcare system in America. It's called county hospitals. And they was all you crazy. I said, well, how? I said, because the law said that you have to treat people. No conversation, no debate, you can't throw them out, you have to treat them. What was the net result of that? They saw massive numbers of people coming in because they did not have the kind of community clinics they were used to going to. So they began to have to service them. What was the net result of that? Property taxes increase. And so when people say, I don't want to have to pay more for my health care, I'm saying, oh, baby, you already pay. Oh, you're paying a lot more than you think that you're paying. Because every time they have a county shortfall because of the hospital, and you can go to nearly every county in America, and I can guarantee you, if they have a budget shortfall, 2/3 or even 80% of that is a direct result of the county hospital. That's where it's coming from. And so we had that kind of system. And so hospitals, for profit and non-profit, should be saying, if we have a brand that is recognized in the community, then why are we not beating other folks to the punch and creating our own wellness centers and our own 24-hour clinics in different parts of the various cities and the counties, because that's where the need will actually be. Then when you do that, they aren't coming to the hospital at 2 o'clock in the morning. You sitting here saying, earache, nose running, cough, go there. And so the people are there, the services will be provided. And again, if you look at the private companies, they are expanding dramatically in those areas. Home health care, same thing. We're seeing those numbers rise because what's happening? People are exercising, they're eating better, they're living longer. And so all of a sudden, what do we need to do in terms of being able to care for our parents? You will have a situation today where you have parents moving in with their children because most of them don't even get along. So I'm not taking care of y'all know. Some of y'all know. You know, some of you right now thinking, man, the last thing I want on my day is dealt with that 18 years, and I haven't come back in. You know what some of y'all do. Trust me. My sister and her 2 kids live in my house in Dallas. My parents retired, and they were looking for a cheap place to teach, and I said, y'all can live rent free. My dad said, the thought, they were on 2 months later. It was killing my sister to be in the same house as my parents. I told her, easy, get your own damn house. It's hard. My house, my rules. I'm and daddy come to stay. And so, even in that particular area, we are going to see massive growth in the healthcare industry as a result of this law. And we are sitting here right now spending all this time mad, complaining, and upset about the law, trying to figure out, what's going to happen down the road, as opposed to saying we have to be smarter and say take advantage of what is coming down the pipe. That to me is how everybody must be operating. And the same thing, now let me deal with the last piece, I think is where individual comes in. Well, actually, yesterday, that I was talking to the first lady. Okay, the guy said, you didn't tell the first lady to mind her own business. It's a radio talk show. If I want a Big Mac, and I want to gain weight, be overweight, that's my right and my business. I said, that's true. I said, you're stupid, but that's true. But here's what's amazing. We have a number of people sitting here complaining about health care reform and costs, and complaining about the high cost of drugs and to take a pill. And then when you begin to talk to them, we're obese, we're not exercising, we're not eating right. We are bypassing the very thing that every single one of us is in control of, and then we're mad because somebody else is trying to create a healthcare system that can help 95% of Americans. So at some point, healthcare providers, and community activists have to own up and say, when do we begin to challenge people just where they are? And that, to me, is the one thing we're scared of. I mean, I saw how some of you responded when I asked you to raise your hand if you even went to one healthcare town hall meeting. Y'all like, why you gotta call me out? That's exactly what I got to think. You sitting there going, man, why did he have to sit here and call me out? Because we don't like to be called out. We want to hold the president accountable. We want to hold Democrats, Republicans. We want to hold the mayor, the county executive, the commissioners. We want to hold the city council. We love to hold everybody accountable except